Eruptive xanthomas are a type of growth that occurs on the skin. They're pretty firm and raised up, and they tend to occur on extensor surfaces, and this means like on the outside of the elbows, the knees, not the inside. This is the flexor surface, this is the extensor surface. Xanthomas are sort of deposits of lipids in the tissue, or kind of like fat or adipose in the tissue. And they can be a sign of you having elevated cholesterol triglycerides. So we usually like to check that if you have this condition. Eruptive xanthomas can be seen in people with poorly controlled diabetes, type 2. It can be seen in people with hyperthyroidism, people with chronic renal failure, that sort of thing. It is pretty rare to get a big outcropping of eruptive xanthomas, but just by the name, they sort of come up, they kind of erupt in people. They see a lot of them. And that is pretty rare. Some people can get just maybe a few of them. I think that if you don't like the appearance of your xanthomas, you may need to have them removed surgically, which is what I do in one of my patients here. But if you want to prevent new ones from coming up, you should treat your underlying condition. If you need to have better control over your diabetes, if you need to make sure that your triglyceride levels aren't elevated, and you normalize that with medications usually or diet, that can help to prevent new eruptive xanthomas from coming up.